Dr. Bill Adams here, and this is No Spin Live. And do we have a show for you today? We're going to talk about the most recent, hot off the press, Buttock Augmentation Advisory and a possible black box warning for breast implants. And we've got some incredible international experts to share their insights. We've got Dr. Jason Posner from Boca Raton, Florida. And then we got Dr. Joe Hunstead from Charlotte, North Carolina. Joe, how you doing, man? You guys got the bad floods though, right?
And rain. It's been amazing, yeah.
All right, well, let Jason lead us off on this one. Buttock augmentation has been under fire for a while now. It's basically the death rate has been very high. The highest any procedure, 1 in 3,000 is the published rate. There's been a combined task force of multiple plastic surgery societies have done some great work, but they just put out another advisory with very stringent recommendations. So lead us off and tell us your thoughts.
It's interesting because we've talked about this multiple times on No Spin Live. And, if you look on Real Self and the other question and answer formats, there's a lot of questions about buttock fat grafting. Matter of fact, it's interesting today, I got 2 emails, one from both societies, ASPS and ASAPS, about buttock fat grafting, and another one from the Florida Board of Medicine, because the Florida Board of Medicine also put their 2 cents in for this. They all said the same thing. Keep the fat above the muscle. Matter of fact, it's illegal to inject fat under the muscle in the state of Florida now, which is following our society's lead. So I think the Florida Board of Medicine got very good information from all these societies, and they actually came up with a reasonable law that makes sense because Florida has been the hotbed for all of these deaths. So we've known this for the last couple of years based on the anatomy dissections of our peers and all the data that we've talked about on No Spin. So keep the fat above the muscle. It's a safer plane. I'm sure the death rate will plummet if we all do this and stick to these guidelines. And I'm not a big fan of huge butts anyway, and I've always tried to keep it above the muscle. It scares me to inject deep. So, again, safety profile for all of us, betterment for plastic surgery, better for our patients, and way safer, obviously.
Yeah, Joe, what's your read on this?
Well, we've been doing buttocks fat grafting for many years, and fortunately, knock on wood, we have never had a fatality or a pulmonary embolism. As a matter of fact, I remember when I heard about the first death because of this, and I was really taken aback. But Florida has been the hot seat, Jason, because I think there are so many of the procedures being done with very large, and people have been proud and have been touting large volume buttocks augmentation. And to get large volume, unfortunately, they have to use pressure, and they have to inject typically in all layers, and safety first for our patients. I completely agree with subcutaneous fat grafting with the guidelines that were set up by the Aesthetic Society, ASPS, ISAPS, as well as the other groups. And I did receive those 3 emails today from ASAPS, ASPS, and ISAPS. And you know what? Safety first. You can get some really good results with subcutaneous injection, being cautious. You can deliver that really nice shape and not have to violate that muscle. And we all know the anatomy of the muscle of the buttocks, the gluteus muscle, and the huge diameter of the inferior gluteal veins. And undoubtedly, that's the recipient of this fat. And then when it goes into your system, you can't resuscitate these poor people. It's a tragedy right on the table. So we need to prevent that.
And we can always come back and graft more if they want more fat. Absolutely. And obviously the problem with putting too much fat in one plane is it keeps popping out of the hole. So there's a limit of how much we can put in at once. So let's come back and do more in a safe, alive patients rather than, risking their lives by putting too much too deep.
I think the other thing that you guys can maybe briefly comment on, and certainly technique, where you're putting the fat, that's, you guys are really speaking on that, which is really the point of this most recent advisory. But there's also, especially I think in Florida, Jason, there's a lot of these people that are going to these kind of cut rate clinics and having surgery by people that have certainly aren't board certified in plastic surgery. So there's a lot of that part too. And we certainly talked about this. So it's really important, I think, if you're going to have a buttock augmentation, make sure you go to start with the board certified plastic surgeon and make sure they're a member of the Aesthetic Society, make sure they've done a lot of this procedure. It's like Joe's done a ton of this, Joe, don't you think that a number of procedures you've done are really important probably in expertise?
I think the more and more experience you get, actually the safer you become. I think you understand where to put it, how much to put it, under what pressure, what instruments are used best. And again, it's something that I just think we need to be cautious with. And again, I agree with Jason. You can do this in a staged fashion. You can be super safe, get a nice fullness, and if you want to come back, you can do it again. It's absolutely fine. And I think safety first, and sharing with our patients what the real risk is. If you tell a patient up front, if we inject this into the muscle, if we inject too much, if we inject under too high of a pressure, we could have a potential fatal incident, and I cannot save you from that. And they're going to get the message. They're going to come through and say, I get it. Thank you for sharing with me. Safety first. Let's do this right.
You know what, just to take off on what Bill said, is any of you read the Malcolm Gladwell books called Outliers? And one of the things he mentions in that book is it takes a certain number of hours, 10,000 hours, to get proficient in anything. So, I think for a consumer, one of the things they should ask when they go to a plastic surgeon's office is, well, how long have you been doing this and how many have you done? Because many of our people are maybe board certified, but they mostly do hand surgery, and they might do one buttock augmentation every 5 years. I'd like to go to them to fix my hand fracture, but not to do my butt.
All right, well, that's good stuff, guys. Let's go on to the next topic. So this came out of the FDA committee meeting, which was in the end of March of this year. And there was discussion about placing a black box warning on breast implants. This is mainly about the risks, particularly about breast implant ALCL. So, this is still something that's percolating. It's a kind of a hot discussion topic amongst many groups. What do you guys think about this? Jason, lead us off.
It's interesting. Buying a breast implant is not like buying a pack of cigarettes where they give it to you and you get to read the black box warning. So if there's something on the label of the implant box, the consumer will never see this. Same thing with Botox. There's a black box warning on Botox about botulinum toxin. That hasn't stopped anyone from getting Botox that I've ever seen. I think this whole process is making the patients aware that with certain type implants, there's a small risk of certain issues. And then it behooves us to be able to discuss that with the patient, not the breast implant box label. I think that every patient that I see for breast surgery that's getting an implant, we discuss the risks and benefits of the procedure, including the risks of textured versus smooth implants and the small risk of ALCL that you will see with a textured implant. And we've discussed this on No Spin before. I'm not a fan of textured implants. So I tell the patients, I don't like to use textured implants. I wouldn't recommend it. I wouldn't put it in my family member. And by going with smooth implants, you basically have a zero risk of ALCL. So, you're going to put a zero risk label on a box of smooth implants. It doesn't make a lot of sense to me. I think it, again, behooves us to discuss the pros and cons of any procedure we do with our patients.
Yeah, it's problematic. There's never been a true 100% smooth documented case of ALCL. It's something that we really owe our patients as far as achieving informed consent, which is a process, sharing with them all the risks and possible complications so they can weigh the benefits versus the risk. And ALCL is part of our conversation. I currently use only smooth, but I have used textured in the past when I use form stable implants. If you've got an anatomic form stable implant and it's smooth, it won't stay in a position and it needs to be textured to hold firm. The FDA understands this and realizes the risk is extraordinarily rare, and they have kept textured implants on the market. Unfortunately, as we all know I lived through the breast implant crisis in 1992, this is a political issue as much as a medical scientific issue. The FDA is a political organization, and they may cow down to certain political groups. We may see this black box warning, but as Jason said, highly unlikely that the patient's actually going to see the box. But when we do our proper informed consent, we're going to go through these things, and that's one of the things that's important for us to really share with the patient all the potential risks and complications, reasonable ones, so they can make that informed decision themselves.
Yeah, I think one thing I would just say is I definitely don't view this as an FDA problem, because I think we're in a new era with the current FDA, who I think are excellent, and certainly an interaction that we've had the last committee meeting and other interactions. I think they're very intelligent. They're very well thought out. They're very we want to basically get input from multiple stakeholders. So I think they're doing a great job. I think you guys raised the good points. If this is about creating awareness, if it's surgeon awareness, if you have informed consent, things like that, a standardized informed consent, that creates patient awareness. But if you want to create surgeon awareness, if it does, I think we're all for it. I think what you guys have voiced is it's just maybe that's not the best way because it's not really going to do that. Maybe these other things, the educational things that we're doing at the Aesthetic Society and other societies in plastic surgery, I think they've been really good. The awareness about breast implant ALCL amongst surgeons has gone up probably 10,000% in the past 3 years just through educational venues. So I think that's the question. But I really think this is not an FDA problem. I think this is FDA wants to know what the best thing would be to do, and I think you guys have nicely voiced the pros and cons.
Take off on this. We've all been in practice for a number of years, and when we first started, there were physicians that we used to see at the meetings every single time. We went to a lot of meetings and kept up on things, and there were physicians that stayed home and really didn't keep up on things. Yet with all the electronic information that's disseminated now, there's no reason why any of our peers are not kept up to date on all of the new things in plastic surgery. So as you said, everyone knows about this now. If someone doesn't know about ALCL, they've had their head in the soil for a couple of years.
Yeah. And Bill, you really need to be congratulated because Bill was one of the members that presented to the FDA in March, really discussing all of this with them and getting the FDA to understand and to know plastic surgeons. And, thank you and the other members that attended those important meetings. It was really crucial.
And I know a lot of the FDA people from the laser side. These are very smart individuals who understand their job, and they really want to learn about the things before they just come down and make decisions. I really think the FDA, as Bill said, is doing an excellent job over the last number of years.
Yeah, it's definitely a different era in terms of certainly breast device regulation, and even the patient groups are very collaborative, which was definitely not the case 25 years ago. You never would talk to I don't think anybody talked to patients. So I think it's much more collaborative. I think so hopefully with that kind of different culture within regulatory things and medical devices, it'll be better for everybody and ultimately, the patient. So, all right, boys. Well, listen.
Who's visiting today? Cece's visiting today.
Oh, Cece. Does Cece have an opinion? Probably so.
What do you think, Cece? You want some breast implants?
I don't think we can translate on dog language, but maybe the next minute. All right, guys. Listen, great stuff. If you want to see more of this, you can see it on theplasticsurgerychannel.com.